A very warm welcome to everybody to our first Share and Learn in Nottingham City ICP. It's absolutely brilliant to welcome you to this first session. We've got 30 minutes today. I'm really delighted that Rich Brady, our programme director, is going to talk to us and provide us an introduction to the Nottingham City Integrated Care Partnership. And so we've got around 20 minutes for a presentation and then 10 minutes for a question and answer. And what we're asking is that any thoughts, reflections or questions that you just post them in the chat box. And I'll be keeping an eye on that as we go through, and then we can ask Rich those questions. All right, so hope it's of benefit. We'll be really keen to get your evaluation, but really delighted to have you with us. And I'm going to hand over to Rich now. Sorry, my apologies. I haven't said who I am, so apologies. I'll just say I'm Tracy Tyrrell. I'm Deputy Clinical Lead for the ICP, and I'm also the Director of Nursing and AHPs at Nottingham City Care. So my sincere apologies, I sort of launched in there, but really warm welcome, and I'll hand over to Rich now.
Thanks, Tracy. And yeah, good afternoon, everybody. My name is Rich Brady. I'm the Programme Director for the Nottingham City Integrated Care Partnership. And yeah, pleasure to be kicking off the first of a long series of Share and Learn sessions. I know we've got quite a few planned over the next sort of few months, so it's nice to be able to start this off. And today, what I'm going to do is sort of take it back to basics and run through what the City ICP is. I'm going to give you a bit of introduction to our partnership. So it's the Nottingham City Integrated Care Partnership, commonly referred to as the ICP, as we love an acronym. So what I'm going to do today is I'm going to talk you through who we are, including our purpose, why we've come together, what our areas of focus are as a partnership, how we work together as partners within the city and outside the city as well, some of our achievements so far, and then our plans going forward. So to start off, then we've got a number of partners that operate within the City ICP. The logos that you're seeing go up on your screen there are the sort of founding members of the Nottingham City ICP, and all of these organisations have sort of come together. I think it was around sort of May, June time in 2019. And they've come together as they've all got a kind of key role to play in supporting the health and well-being of citizens in Nottingham. And these are the kind of founding members of the ICP and very much sort of make up the kind of strategic sort of planning of us as an ICP. But we're not sort of limited to these organisations. While these organisations absolutely have big influence on the way in which people access and receive services within the city, there are a range and host of much broader services that can support people's health and well-being. So alongside partners in hospitals and primary care, mental health, community services, we've also got the City Council, who play a real leadership role within our City ICP, got housing services, drug and alcohol support services, and then a wide range of voluntary sector services as well. And really importantly, Nottingham and Nottinghamshire Health Watch is a member of our ICP and have really helped us in our developmental stage, which I will note as we go through the presentation. So before I kind of get into the City ICP itself, this would be important to give some sort of broader context as to where we sit within Nottingham and Nottinghamshire. So the Nottingham City ICP is part of the Nottinghamshire integrated care system, and really the integrated care system has got sort of strategic function across the city and county, whereby it sort of sets the strategic direction for the whole system. So that's just for the city and the kind of wider county services. So it covers a population size of about 1.1 million. It sets a strategic plan and some delivery objectives, which we're all, as partners, constituent individual organisational partners, but ICPs, we are responsible for delivering that strategy. There's some various functions that sit within the ICS, such as population health management. There's a fantastic team that works to identify and understand population health needs using data and information from across all of the different organisations that exist within the system. and it comes up with various strategies, and also has played a really important coordination response alongside the local resilience forum to the COVID-19 pandemic. And yeah, we are a key part of that integrated care system. So as you can see on the screen, there are 3 ICPs within the integrated care system. The City ICP was actually born out of the Greater Nottinghamshire ICP, which, as you can see on the slide there, we have City and South Nottinghamshire. Previously, we had Greater Nottinghamshire, but the City ICP was created because of the sort of different population needs that exist within the city compared to the wider county. And there's lots of organisations that work specifically in the city, so the decision was taken to have a city-based ICP, and we very much cover that city boundary, so we share the same footprint as the local authority, as Nottingham City Council. And within the city, there is huge amounts of diversity that exists, and you know, the ICP was sort of set up to represent that. And specifically, we've got a really high population. We've got a 35% proportion of people from Black, Asian, and minority ethnic communities within Nottingham City, and you know, the way in which we need to respond to different types of health needs from different communities will change depending on first population need, but then also the services that we've got to support that need. So as you saw earlier, this is more than just a health partnership, and the reason for that is because we need to focus on supporting people's health, and that's looking at the wider determinants of health. This is kind of well used image here, where it sort of shows just how much of an impact healthcare has, access to healthcare has on your overall health. And you can see that 40% of impact on your health actually comes from socioeconomic factors. So that's where you live, your income, your access to education, employment, community safety, social support that you might have around you, you know, really impacts. And I think we've seen that a lot throughout the pandemic, just about how the socioeconomic but also environmental issues impact on our overall health and well-being. Obviously 30% here, it says that is reliant on health behaviours, and I think that's really come into play this year. We've seen you know, the importance of behaving in a way that supports our own health and well-being. So, you know, we can't do this alone, just as health partners. It's, you know, just the NHS or other health organisations working together is not enough. We have to work much broader than that, and that's because you know, the wider determinants and the access to assets within the city are really important. And these kind of sets of infographics here sort of show actually some of those wider determinants. So within Nottingham City, it's really important to understand the population need and what people have access to or don't have access to when thinking about how to support people and to deliver healthcare. So, you know, under almost half of people within Nottingham don't have a car. Many people rely on public transport, as you can see there. There's highest bus use outside of London. The majority of people within the city are of working age, and many people the majority of people actually rent rather than own their own homes, which, you know, has an impact on housing and upkeeping of good housing. Nottingham has really poor actually health and life expectancy for both males and females. It's actually up there with the lowest healthy life expectancy in the country. So it's really important that that we all kind of work together, you know, to support people's health and well-being. And on the left-hand side here, you can see some of that diversity comes out here with the number of different languages that are sort of spoken within the city. 7.8% of households don't have any people who speak English as their main language, and that's a really important thing for us to think about in terms of how people access information, but also access services as well, and how we want to communicate that. And we're absolutely seeing that. I mean, colleagues here today who are working on the COVID vaccine programme, you know, may be familiar with some of the sort of conspiracy theories that exist around the vaccine within different community groups, and how we translate those messages to different communities is really important. So it's important that we think outside the box. So our aim as an ICP is to make things easier for people. As you can see from this graphic here, there are lots of different types of services, and we're expected as people who want to access those services to access them depending on what our need is. So if we have an urgent care need, we might go to hospital. If we have a mental health need, we might need specialist mental health support. If we got a need that can be dealt with as a GP, we'll go through primary care. We've got a social care need. At the moment, people are having to navigate a really complex sort of system, and organisations quite often work within silos. You hear that said a lot, and it's up to people to have to navigate these systems. And I think even as professionals, actually, sometimes we struggle to be able to join up services. And so it's really the role of the ICP then to remove some of that complexity, so to better join up services around people. So it doesn't matter whether you've got a physical health need or a mental health need or a social care need or a substance misuse need. We work actually around the needs of people, getting rid of that complexity and doing that work on behalf of people rather than the other way around. So how are we going to deliver this joined up care? Well, a really key part of the ICP are the primary care networks, and primary care, some of you may be familiar, some less so, were generated in July 2019 in Nottingham. We've got 8 in Nottingham City, and these have been the sort of area boundaries where they operate have been determined depending on the kind of needs in the communities. And really the primary care networks sort of show actually the big difference in population need depending on where you are in the city. And so what we've got is those primary care networks operating in different parts of the city, serving populations of around 30,000 people up to about 65,000 people, I think it is, in Nottingham City East, whereby the idea is for people to work better together around the needs of their population. And so they've started off very much as GP practices collaborating together, but there's lots of great work going on within those primary care networks and within our ICP to support them, to help, and some of them are really maturing into sort of more integrated community mental health, social housing, social care, housing, voluntary sector services, and really importantly neighbourhood services as well, sort of within what's traditionally delivered by the city council. And so in order for us to do that, in order for us to deliver that joined up care and support at that kind of local level, it's really important that we all kind of work together around those clearly defined boundaries, and we're doing lots of great work within that. The primary care networks have made some great progress in their first year, developed some really good relationships. We've developed extra roles around the PCNs to support them with sort of wider needs, and their response specifically to the COVID pandemic. I mean, there's a huge amount of work that's going on within the primary care networks, and everyone's worked really hard to respond in the community, specifically originally around the initial response to the pandemic, and up until recently with the COVID vaccination programme. So it's a real need for us this year, and certainly a strategic objective for us as an ICP to really help to strengthen and develop those PCNs as they're in their second year. So that's the kind of structure of the ICP, who we are, and kind of how we all fit together. When we first came together, we needed to understand actually what our purpose was, and so we wanted to understand and work with different partners within the city to work out where we kind of add value. There's lots of organisations within the Nottingham City ICP who do lots of great work as an organisation, and sometimes those organisations are the best placed organisation to do that particular work. So for instance, the hospital, it should deliver critical care. There's not necessarily a need for other organisations to get as strongly involved with that. But then there's other areas of work perhaps which might benefit from having more of a sort of partnership approach. And we wanted to work with our partners, but also with people who live in Nottingham, to understand where we should focus, so that we can make sure that Nottingham City residents have equal access to care and support, regardless of where they come from, their circumstances, or where they live in the city. So it was around about a year ago now, actually, that we sort of came together as partners, and some work led by Nottinghamshire Health Watch and Nottingham Community and Voluntary Service to understand where we thought we should focus as a city. We engaged with a large number of organisations. On the right hand side of the screen here is a sort of flyer from an event that we held with people sort of representing communities within Nottingham to understand where we should focus, and we used a lot of that feedback. We used population health data and public health data, feedback from those groups, local intelligence on where we can really focus and where we think we can have the biggest impact. And resulting out of that were 5 initial priorities, which you can see on the screen there now. So we've got 5 particular priorities that are focused around supporting cohorts of people within Nottingham, and then we've also got 2 priorities, 6 and 7, there on the screen, which are more focused around sort of developing the partnership and helping to support our partners in the response to COVID-19. So those 5 priorities are: firstly, supporting people who face multiple disadvantage to live longer and healthier lives. As I said earlier, the healthy life expectancy for people in Nottingham is up there with the lowest in the country, and there are lots of people who are living in areas of deprivation and experience kind of multiple levels of disadvantage. So we want to be able to work together as organisations. We've all got a role to play in supporting people. We know that there's around sort of 5,000 people. Well, we certainly knew before the pandemic there was around 5,000 people that would be seen to be facing severe multiple disadvantage. It's quite likely that number's got larger now. So we think as a partnership we can really focus our efforts to support people. The second one, on better preparing children and young people to leave the care system. The outcomes for care experienced young people in Nottingham who leave care are not good, and they haven't been for a little while, and we feel that we can do more as organisations to work together to support them, so they don't fall off that sort of cliff edge of support once they leave care, once they've left sort of children's services. And we're partnering. We're really excited to be able to partner with Bernardo's, the children's charity, on a piece of work there. Smoking is a big issue in the city. In that there are really high smoking rates. Lots of people still smoking, and within our primary care networks, there are some areas where sort of 1 in 4 people still smoke, and we feel that we can do sort of more as a city to help people to quit, for those who want to quit, but also prevent people from smoking in the first place. Similarly, we know that we previously have not been particularly well performing in flu vaccinations. Obviously, vaccinations are very key at the moment, but getting that annual flu vaccination, historically in Nottingham City, we've worked in silos individually to try and encourage people to get their vaccines, and we wanted to take a more sort of coordinated approach this year, and we've done that, and I'm going to talk a little bit more about that alongside some of the other work of the priorities in just a second. But lastly, our 5th priority is around reducing inequalities and health outcomes in Black, Asian, minority ethnic communities. As I said earlier, 35% of people in Nottingham are from a Black, Asian, minority ethnic community. We know that perhaps mainstream services are not always the most sort of culturally sensitive, and as a result, people feel that they don't get access to the care and support that they need. So as an ICP, we want to look at that. We want to understand, why there are sort of poorer outcomes within Black, Asian, minority ethnic communities within Nottingham, and what we can do to support. So I'm going to talk to you very briefly about some of the achievements of those groups, but just those priorities. But firstly, just to show you that these are all led by our individual partners. So those people you see on the screen there, while they work for these organisations, they are working on behalf of the ICP. So all of our partners are resourced from the partnership.
Rich, we're at about 20 past now, so just to make you aware. Yeah.
Thanks. Yeah, just a few more minutes. So lots of work that's gone into this, and I'm obviously conscious of time. I probably don't want to run through in too much detail. So I'll probably sort of skip over some of these sort of key achievements. But what's really happened within Nottingham, in the Nottingham City ICP over the last year, is that we've coordinated efforts, and by working together, we've really helped to improve kind of health and wellbeing outcomes and reduce some of those health inequalities. So briefly, within the Severe Multiple Disadvantage Programme, we've had a really sort of targeted approach to supporting people who sleep rough. And prior to the pandemic, compared to now, we've enabled 70 people now to live in long-term accommodation who prior to the pandemic were sleeping rough. Within the care leavers work, we're about to support 10 children and young people now into supported lodgings, which are kind of supported accommodation for people after the age of 18, so after they are receiving care and support from children's services. And we're also doing a really important piece of work there between the commissioners within the city council and the CCG to look at transition pathways before children and adult mental health services. Within smoking, we held a great campaign in October alongside the National Stoptober campaign, which has seen a big increase in people wanting to quit, and the GP Alliance, who run the Stub It smoking cessation service, increased the capacity, and we're able to fill that capacity, and as a result, 50% more people access the service, and that led to 50% more people quitting, which is a really great start. But there's more for us to do within that area. There's lots of smoking cessation services around the city that we can join up better together. Within our flu programme, we have identified 3 particular cohorts that we don't work particularly well with, or haven't, could really do better in increasing uptake with the vaccine. And those are pregnant women, people under the age of 65 with respiratory issues, and primary school age children. And we've increased uptake across all of those already, and we'd far surpassed last year before Christmas, and we're continuing to hit that as well. And then finally, within our Black, Asian, minority, ethnic work, we are working to look at some of those kind of structural barriers and issues that exist within our system that exacerbate those inequalities. And I know Tracy's about to hurry me up, but I'll just finish on the last moment of it's been a really good year for us as an ICP, in terms of us coming together, understanding our vision, understanding our purpose, getting resource around in the city. And now for our second year, we're really looking to kick on. And there's a big consultation that was done recently around the future of integrated care systems. We believe our ICP is a big part of that, and we'll continue to work with our other ICPs in the county and with our integrated care system to get us in the right place to where we need to be. So I'll stop there and hand over for questions.
Thanks, Rich. Great presentation. So the first question we've been asked is, can we share the presentation? And absolutely, both the recording and the presentation will be shared. And then we move into some questions. So Rich, the first question is really about your thoughts on how the ICP supports inclusivity within primary care. So have you got any thoughts around that?
Yeah, well, so inclusivity. So I guess that sort of means organisations beyond kind of GPs and other sort of primary care services working together. I mean, I think that the thing to say about this, I guess, at a primary care network level, is that we've all got to, we all see the same people, and we've all got a role to play, and we have to be able to understand what it is that our role is in supporting people. I think quite often some of the work certainly that you've done, Tracy, around supporting those primary care networks is actually there's not always as well a developed understanding of what other organisations do. And I know, well, Tracy, you're probably better placed to talk about this than me, but we're doing quite a lot of work in terms of understanding how we can be more inclusive and more joined up in our approach to supporting people's needs.
Yeah, absolutely. And myself and Hussein, who's the other deputy clinical lead, we've been working with some of the PCN clinical directors and other colleagues to start some of that work in small scale projects. So you're absolutely right, Rich. There's a lot of work which is about, can we work together? Can we get to know each other more? And then does that allow us to actually work more effectively together? Because we're obviously all caring for that same population and wanting the same health outcomes. Yeah. OK. Another question, Rich, is, somebody, obviously Claire's saying that it was a great presentation, so thanks, Claire. Do you see the priorities changing significantly for 21-22?
Yeah, good question. So I think this isn't necessarily up for one or two people to decide. This is something we've got to decide as a partnership. And also we've got to get feedback from people as well who use services. So what we're going to be doing is we're going to be reviewing the progress of those priorities that we've had for this year, and then taking into account the very changing world that we're now living in, and I think the changing population needs now that are there. So I feel that we've made some great progress with these priorities, and some of them I think we'll absolutely want to stick with. But I think that there will be others that we might want to look at taking into our programme approach within the ICP. So I do see them changing to a point of us, having to adapt to the different population needs. But I also feel that we will adapt our current priorities as well to meet the sort of changing landscape that we now operate in.
Thanks, Rich. Interesting from Sarah. Sarah's asking about a particular role in the city, which I know is part of one of the PCNs. So it's the Admiral Nurse role. And we might want to get some further information out to Sarah and colleagues probably after here. But just really thinking about increasing and developing services for people with dementia. Sarah's one of our specialist nurses in city care, but she's talking about, she can see that through the pandemic this has been a complex group, and whether there's any future plans really to look at this group of patients and to consider their care. Yeah,
so I think it's really important, and I think that what we want to do is within our primary care networks, and I know that we've specifically done some work within one of the primary care networks in the south around this particular area. Is, as I said earlier, the population need is not the same across the PCNs, and therefore it should be up to those primary care networks to actually determine where their areas of focus are. So where dementia might really be a focus perhaps in the south or perhaps southwest of the city, it might not necessarily be in the east or the north, and therefore, if the population need is not there, we should not try and divert all resources to it. We should focus that resource actually where that population need is. So those priorities that we've talked through as a city are kind of at city level. I think we also now want to be building those at a primary care network level, so that we've got those more refined programs that are there to meet that population need within that area.
Okay, thanks, Rich. We're probably running out of time slightly. We've just got 1 minute left, so we've got some great questions coming in. But I think one of the questions is probably is just asking, is this not just adding a level of process to what we're already doing? So really keen to hear your views on that, Rich, as programme director.
Yeah, thanks. Good question. So I would believe not, because and the reason I would say that is because I think from the very beginning of setting up this City ICP, we're very conscious of wanting to add any kind of additional layers of governance or bureaucracy or anything that just makes, you know, delivering care more difficult. And I think that as an ICP, with those particular priorities that we've talked about, those are ones that we as organisations have agreed that we don't do enough on, and, you know, we can do more on together. There are lots of other programs of work. So, for instance, the COVID vaccination program is the most kind of recent example of this. You know, you might think that as a city partnership, we're really well placed to be able to support the kind of coordination of the COVID vaccine program within the city. Well, it's that work is being done to a really excellent standard in other parts of the system. And, you know, if we can add value to that work that's happening, then we'll get involved, but otherwise we'll leave it to the experts who are doing it. So, you know, in terms of, is it adding additional layers, I would say that one of our kind of guiding principles for developing our priorities was to make sure that it doesn't, and if it starts to, then we need to review our priorities to work out if we've got them right.
Thanks, Rich. So we're there on past. So that's our first share and learn. Obviously, we thank you, Rich, for your presentation, and we thank everybody for joining today. We're holding these now regularly, and the dates are being published, so do look out for the next one, and we'll make sure that we send that date to you all who have joined today. But thank you, and we'll be keen to hear any feedback you've got. Obviously, this is our first one, so we're keen to learn and develop these to make sure we're meeting need. But thank you, everybody, and again, thanks for joining. We know it's really busy out there, so thank you. Bye, everybody.